Drugs and alcohol abuse. Surveys and statistics show that use of drugs and alcohol has been on the rise, especially among the youth. This is really a cause of concern as it could result in many harmful effects. Proper education and guidance would enable youth to safeguard themselves against these dangerous behavior patterns and follow healthy lifestyles. The drugs which are commonly abused are opioids, cannabinoids, and coca alkaloids. Majority of these are obtained from flowering plants. Some are obtained from fungi. Opioids are the drugs which bind to the specific opioid receptors present in our central nervous system and gastrointestinal tract. Heroin, which is commonly called as smack, is chemically diacetylmorphine, which is white, colorless, bitter crystalline compound. This is obtained by acetylation of morphine, which is extracted from the latex of poppy plant, Papaver somniferum. Poppy plant, Papaver somniferum. Generally taken by snorting and injection, heroin is a depressant and slows down body functions. Cannabinoids are a group of chemicals which interact with cannabinoid receptors present principally in the brain. Natural cannabinoids are obtained from the inflorescence of the plant Cannabis sativa. The flower tops, leaves, and the resins of the cannabis plant are used in various combinations to produce marijuana, hashish, charas, and ganja. Generally taken by inhalation and oral ingestion, these are known for their effects on cardiovascular system of the body. Coca alkaloid or cocaine is obtained from coca plant Erythroxylum coca, native to South America. It interferes with the transport of the neurotransmitter dopamine. Cocaine, commonly called coke or crack, is usually snorted. It has a potent stimulating action on central nervous system, producing a sense of euphoria and increased energy. Excessive dosage of cocaine causes hallucination. Other well-known plants with hallucinogenic properties are Atropa belladonna and datura. These days, cannabinoids are also being abused by some sports persons. Drugs like barbiturates, amphetamines, and benzodiazepines and other similar drugs that are normally used as medicines to help patients cope with mental illness like depression and insomnia are often abused. Morphine is a very effective sedative and painkiller and is very useful in patients who have undergone surgery. Several plants, fruits, and seeds having hallucinogenic properties have been used for hundreds of years in folk medicine, religious ceremonies, and rituals all over the globe. When these are taken for a purpose other than medicinal use or in amounts or frequency that impairs one's physical, physiological, or psychological functions, it constitutes drug abuse. Smoking also paves the way to hard drugs. Tobacco has been used by human beings for more than 4,000 years. It is smoked, chewed, or used as a snuff. Tobacco contains a large number of chemical substances, including nicotine and alkaloid. Nicotine stimulates the adrenal gland to release adrenaline and noradrenaline into blood circulation, both of which raises the blood pressure and increases heart rate. Smoking is associated with increased incidence of cancers of lung, urinary bladder and throat, bronchitis, emphysema, coronary heart disease, gastric ulcer, etc. Tobacco chewing is associated with increased risk of cancer of the oral cavity. Smoking increases carbon monoxide content in blood and reduces the concentration of hemobound oxygen. This causes oxygen deficiency in the body. When one buys packets of cigarettes, one cannot miss the statutory warning that is present on the packaging, which warns against smoking and says how it is injurious to health. Yet, smoking is very prevalent in society, both among young and old. Knowing the dangers of smoking and chewing tobacco and its addictive nature, the young and old need to avoid these habits. Any addict requires counseling and medical help to get rid of the habit. Adolescence and drug or alcohol abuse. Adolescence means both a period and a process during which a child becomes mature in terms of his or her attitudes and beliefs for effective participation in society. The period between 12 to 18 years of age may be thought of an adolescence period. In other words, adolescence is a bridge linking childhood and adulthood. Adolescence is accompanied by several biological and behavioral changes. Adolescence, thus, is a very vulnerable phase of mental and psychological development of an individual. Curiosity, need for adventure and excitement, and experimentation constitute common causes which motivate youngsters towards drug and alcohol use. A child's natural curiosity motivates him or her to experiment. This is accomplished further by effects that might be perceived as benefits of alcohol or drug use. Thus, the first use of drugs or alcohol may be out of curiosity or experimentation, but later the child starts using these to escape facing the problems. Of late, stress from pressures to excel in academics or examinations has played a significant role in persuading the youngsters to try alcohol and drugs. The perception among youth that it is cool or progressive to smoke, use drugs or alcohol is also in a way a major cause for youth to start these habits. Television, movies, newspapers, internet also help to promote this perception. Other factors that have been seen to be associated with drug and alcohol abuse among the adolescents are unstable or unsupportive family structures and peer pressure. Addiction and dependence. Because of the perceived benefits, drugs are frequently used repeatedly. The most important thing which one fails to realize is the inherent addictive nature of alcohol and drugs. Addiction is a psychological attachment to certain effects such as euphoria and a temporary feeling of well-being associated with drugs and alcohol. These drive people to take them even when these are not needed or even when their use becomes self-destructive. With repeated use of drugs, the tolerance level of the receptors present in our body increases. Consequently, the receptors respond only to higher doses of drugs or alcohol, leading to greater intake and addiction. However, it should be clearly borne in mind that use of these drugs, even once, can be a forerunner to addiction. Thus, the addictive potential of drugs and alcohol pull the user into a vicious circle, leading to their regular use or abuse, from which he or she may not be able to get out. In the absence of any guidance or counseling, the person gets addicted and becomes dependent on their use. Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs or alcohol is abruptly discontinued. This is characterized by anxiety, shakiness, nausea, and sweating, which may be relieved when use is resumed again. In some cases, withdrawal symptoms can be severe and even life threatening, and the person may need medical supervision. Dependence leads the patient to ignore all the social norms in order to get sufficient funds to satiate his or her needs. These result in many social adjustment problems. Effects of drug or alcohol abuse. The immediate adverse effects of drug and alcohol abuse are manifested in the form of reckless behavior, vandalism, and violence. Excessive doses of drugs may lead to coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. A combination of drugs on their intake along with alcohol generally results in overdosing and even deaths. The most common warning signs of drug and alcohol abuse among youth include drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationships with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuations in weight, appetite, etc. There may even be some far reaching implications of drug or alcohol abuse. If an abuser is unable to get money to buy drugs or alcohol, then he or she may turn to stealing. The adverse effects are just not restricted to the person who is using drugs or alcohol. At times, a drug or alcohol addict becomes the cause of mental and financial distress to his or her entire family and friends. Those who take drugs intravenously, direct injection into the vein using a needle and a syringe, are much more likely to acquire serious infections like AIDS and hepatitis B. The viruses which are responsible for these diseases are transferred from one person to another by sharing of infectious needles and syringes. Both AIDS and hepatitis B infections are chronic infections and ultimately fatal. Both can be transmitted through sexual contact or infected blood. The use of alcohol during adolescence may also have long term effects. It could lead to heavy drinking in adulthood. The chronic use of drugs and alcohol damages the nervous system and liver cirrhosis. The use of drugs and alcohol during pregnancy is also known to adversely affect the fetus. Another misuse of drugs is what certain sportspersons do to enhance their performance. They misuse narcotic analgesics, anabolic steroids, diuretics, and certain hormones in sports to increase muscle strength and bulk and to promote aggressiveness and as a result increase athletic performance. The side effects of the use of anabolic steroids in females include masculinization, features like males, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and body, enlargement of clitoris, deepening of voice. In males, it includes acne, increased aggressiveness, mood swings, depression, reduction of the size of the testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of the prostate gland. These effects may be permanent with prolonged use. So, in the adolescent male or female, severe facial and body acne and premature closure of the growth centers of the long bones may result in stunted growth. Prevention and control. The age old adage of prevention is better than cure holds true here also. It is also true that habits such as smoking, taking drug or alcohol are more likely to be taken up at a young age, more during adolescence. Hence, it is best to identify the situations that may push an adolescent towards use of drugs or alcohol and to take remedial measures well in time. In this regard, the parents and the teachers have a special responsibility. Parenting that combines with high levels of nurturance and consistent discipline has been associated with lower risks of substance means alcohol, drugs or tobacco abuse. Some of the measures mentioned here would be particularly useful for prevention and control of alcohol and drugs abuse among adolescents. Number 1. Avoid undue peer pressure. Every child has his or her own choice and personality, which should be respected and nurtured. A child should not be pushed unduly to perform beyond his or her threshold limits, be it studies, sports, or other activities. Education and counseling. Educating and counseling him or her to face problems and stresses and to accept disappointments and failures as a part of life. It would also be worthwhile to channelize the child's energy into healthy pursuits like sports, reading, music, yoga, and other extracurricular activities. Seeking help from parents and peers. Help from parents and peers should be sought immediately so that they can guide appropriately. Help may even be sought from close and trusted friends. Besides getting proper advice to sort out their problems, this would help young to vent their feelings of anxiety and guilt. Now, looking for danger signs. Alert parents and teachers need to look for and identify the danger signs discussed above. Even friends, if they find someone using drugs or alcohol, should not hesitate to bring this to the notice of parents or teacher in the best interest of the person concerned. Appropriate measures would then be required to diagnose the malady and the underlying causes. This would help in initiating the proper remedial steps or treatment. Seeking professional and medical help. A lot of help is available in the form of highly qualified psychologists, psychiatrists, and de addiction and rehabilitation programs to help individuals who have unfortunately got in the quagmire of drug or alcohol abuse. With such help, the affected individual with sufficient efforts and willpower can get rid of the problem completely and lead a perfectly normal and healthy life.